I know that you'll appreciate hearing from them. So I'm going to keep talking here until everybody sits down. Right. I'm Lenz. I'm the founder and publisher of Analyst magazine, or a news organization that has been a watchdog and resource for schools in Chicago for 23 years. I'm going to start with a commercial. We recently published an issue on the aftermath of trauma and services, particularly in Chicago public schools that are or realistically not available to children, and there are copies out back, so please take one with you. I moderated a panel for Voices for Children once before, and I'm really happy to be back here, but I must admit that when Joan called me, one of my first thoughts was, oh man, you know, it's hard to be hopeful these days. State finances, which undergird so much of what you do, are such a mess with no solution on the horizon. Politics at times can be vile. But then I read Kids Counts 2013, cover to cover, and it's like a breath of fresh air. You have to be, celebratory about what all of you have accomplished over these 25 years. I mean, getting organizations to work together, coming up with sound policies, getting the politicians to buy in, and really having results. So to echo James Garbarino, bravo, or his Italian audience, opera audience, I guess would say bravi. We have a fabulous panel. The speakers are going to take a slightly deeper dive into 4 areas that are covered by Kids Count. And those are, and we're going to switch the order a little bit here, then we got 10 minutes ago. Education, poverty, health, and trauma. Each panelist will speak for about 10 minutes, and then you will have an opportunity to ask questions live. There's a microphone back there, but we do hope to wrap up by 11:30 so that you can move on. Very brief introductions. Go back to Sylvia Puente, who I've known for a really long time. She's going to talk about education. Sylvia is the founding executive director of the Latino Policy Forum and chair of the Education Advisory Board, Funding Advisory Board, which is known as EFAB. And this body makes recommendations to the government and legislature about the level of school funding needed to meet children's needs. She also is a board director of Advance Illinois, a bipartisan public policy nonprofit that is working to improve education statewide. And Sylvia was introduced to her life's work as an advocate and policy advocate analyst for Latino issues when, at the age of 13, she joined her mother on picket lines in support of the United Farm Workers Union. And next up, second, will be Erica Williams. She's going to talk about anti-poverty tools. She is a senior policy analyst with the State Fiscal Project of the Center on Budget and Policy Priorities. The center does many things, but it conducts research and analyses to, 1, help shape public debates over proposed budget and tax policies, and 2, ensure that policymakers consider the needs of low-income families and individuals in these debates. It also develops policy options to alleviate poverty. Since joining the center in 2009, Erica's work has focused on cuts to state services, tax and spending limits, and other anti-tax threats, EITC, developments, and trends in poverty. Third will be Amy Zimmerman, and she's going to talk about children's health, especially in the first 3 years. Amy is Director of Child Health Advocacy at Health and Disability Advocates. There she leads one of the nation's first medical-legal partnerships, which works something like this. Attorneys provide legal services in hospitals and pediatric clinics to low-income families. They also offer legal consultation to healthcare providers and social workers to facilitate solutions for parents who are experiencing legal problems. Current sites for this partnership include Lurie Children's Hospital, Comer Children's Hospital, La Vida, Friend Family Health, FQHC. Amy once was a neighborhood and special project attorney at the Legal Assistance Foundation in Metropolitan Chicago. And again, she'll talk about children's health. And then we will wrap up with Jean Griffin, who will talk about trauma. Jean is a clinical psychologist and attorney who works in the fields of child trauma, child welfare, children's mental health, and juvenile justice. He now serves as an assistant professor in the Department of Psychiatry at Northwestern University's Feinberg School of Medicine. He is co-director there of a project funded by the National Child Traumatic Stress Network. Jean has worked with numerous government agencies and at one time was an assistant public defender. So let's get going. Sylvia.
Good morning. Can you hear me okay?
Yeah.
Yes. Good. So thanks, Linda. And I'll just clarify that I've been the director of the Latino Policy Forum for 4 years, but I'm not the founding director. And today I'm really talking to you and speaking to you more in my role as chair of the Education Funding Advisory Board to talk about a little bit about school finances and unfortunately where we're headed. So I feel I've been aware of school finances for a very long time, before I even knew what they were called. As a child, I remember participating in cakewalks to raise money for my grade school. Do you remember those? We paid a quarter at that time to participate, walked around when the music stopped. If your number was called, you got a delicious treat. As a parent, I occasionally, and I have to say occasionally because baking was part of my forte, bake cookies for the bake sale at my daughter's school to raise funds. But never would I have imagined being in the role of recommending the baseline of education funding for all children in public schools in the state of Illinois, as I now am in this role as chair of the Education Funding Advisory Board. As an education, and for those of you that don't know, EFAB was initially established so that there would be sort of an independent, nonpartisan, objective voice on what it really took to fund education in Illinois, apart from what the General Assembly would or would not allocate. So as an education advocate, I'm extremely concerned that no amount of cakewalks will ever be able to address the fiscal woes that the state is facing with respect to investing in the education of our children. So a warning, I am the bearer of bad news and don't have a lot of good news to share. Through the Illinois State Board of Education, the Illinois Education Funding Advisory Board, EFAB, uses a pretty complex funding formula that's informed by low spending and high performance schools to make recommendations around per pupil funding levels. EFAB also makes a supplemental recommendation to address poverty and the additional resource needs that are needed to educate low-income students. EFAB's work is designed to ensure that every Illinois student, despite zip code, enjoys an equal baseline of educational investment. Even in the economically best of times, we all know that this is an arduous task. When you add the state's fiscal crisis to the yawning, persistent property wealth gap that exists in the state, which is caused in no small part by Illinois' over-reliance on property tax revenues to fund education. So long as the status quo remains, and this is no news to many of you in this room, we have some school districts that can afford $21,000 per pupil per student to fund their education on an annual basis, property-rich tax districts. And that this level of resources and allocation in our students will be forever inaccessible to students in the Illinois have-not zip codes, even in periods of relative economic plenty, in school districts that have low property wealth. But in times of fiscal belt-tightening, which have become our reality in recent years, EFAB's work has gone from promoting equity to instead confronting a choice between the lesser of evils. I'm going to want those charts in a second. The hard truth is that EFAB's 2013 recommendation to invest $8,672 per pupil is perceived as a pipe dream. It would require $9 billion in state education funding, double the current $4.4 billion education to become reality. The categorization of this as a pipe dream infuriates me, because really it is the baseline investment, and we're only halfway there. The fact that we are so far off base is an indication of how much we have disinvested in our children. So, to show the other part of this then, is that the EFAB recommendation, as you can see, is the 8,672. That's what analysis says we should be funding at per pupil. The foundation level, which is set in statute, because I know somebody says, well, we can't do that, let's put this amount in statute of 6119, and we are not even funding that. We are funding and prorating, which I'll talk about more in a minute, at a level of $5,445 per student for this year, and it is expected to be even less in fiscal year 14. The next one. And as I mentioned, what this represents is we would need $9 billion to invest in our general state aid. The claim is for $4.8 billion, and we are actually appropriating less than that at $4.278 billion. So you can see the magnitude of, there's no way we're doing what we should be doing, and we're not even doing what we say we should be doing in statute. So the 5462 level, going back to the previous chart in a second. That 5445 is going to be even further eroded potentially in this year's budget. And this shortfall, though, however, isn't news. We haven't been able to afford EFAB's recommendation since 2003, and the gap has in fact widened every year since then. So over the past few years, we have reduced spending in education by nearly $1 billion, $1.4 billion if you adjust for inflation. 2/3 of our school districts are now in deficit spending, and over the past few years, we have laid off over 6,000 educators in the state of Illinois. And with the limited resources we are further exacerbating inequality and further shortchanging our most vulnerable students. Instead, when the state says it will fund the state is not funding at the statutory foundation level, that 6119. Since 2010, this number has been 6119. We have now taken, since we can't even allocate that, we've taken to the controversial practice of prorating funding, which means that low-income schools are getting even more shortchanged, and we are further shortchanging our most vulnerable students. Now, when we say 6119 is a general state aid allocation, it doesn't mean that every school district actually gets $6,119 per student. They get that minus the property tax contribution, which is of course tied to the property tax wealth, and they get something for the most part, usually less than that allocation from the state for students. So poor property tax districts receive more per student from the state than wealthier districts, right? Because it's equalized. We try to remedy the system once we subtract our property wealth. So a poor district might get $5,000 per student in general state aid, for example, and a wealthier district might get $1,000 per student in general state aid. So when we prorate, the practice that we're undertaking now, because we cannot meet our statutory obligation, the schools with more poor children will lose more resources. Does that make sense? Because instead of they're getting more per student because they have less, the 5,000 versus the 1,000 example. So when we prorate, those poor property wealth districts lose even more. In Advanced Illinois, did this really nice report if you haven't seen it, and I would recommend it to you that explains this in further detail. And one of the things it says is that the 20% of schools with the fewest number of poor children will lose $100 per student. So 20% of the schools with the fewest number of poor children will lose $100 per student, but the 20% of schools with the highest poverty rates and the lowest property wealth will lose $519 per student. Again, an indication of how making this policy decision with our challenging economic times really adversely impacts our most vulnerable children. In the aggregate, what this translates into is that 20% of students who attend the poor school districts will lose $160 million, and the 20% of students who attend with the fewest number of poor students will lose $30 billion. So again, another example of this inequality. Further compounding this, Illinois is unable to even fulfill its state constitutional duty to pay the preponderance of education costs. Today, Illinois' contribution hovers at about 25% of total costs to fund children, the state's investment in our youth, with the balance coming from the mix of local property taxes and federal district-to-district funds. As fiscal Armageddon looms in Springfield, our educational choice is an impossible one. Do we continue to backslide on the recommended funding allocation? Do we lower the statutory funding level? Or do we maintain disparity-producing proration practices? All options shortchange Illinois children, especially our most vulnerable students in low-income districts. But not taking action makes a bad system even worse. As we continue to exacerbate the equity gap, and by continuing to disinvest in our children, we fail in our most basic duty as parents, caretakers of all of our children. What we've seen today in hearing the presentation from voices on the Kid Count book, what we heard from our keynote, if this is the situation that we're at in this time, we cannot yet even begin to imagine the extent that this disinvestment will impact our children, their families, our economy, and the future of our state.
Oh, good to follow. Very good, go ahead.
Hi everyone, can you hear me?
Yes.
Good morning. Thanks to the Voices for Illinois Children for having me here today. Thanks to all of you for all the work you're out there doing, the very important work you're out there doing to move policy and programs in support of families and children. Excited to be here. I wanted to talk to you a little bit today about sort of state finances and state financial supports for families and children. In particular, I'm going to talk about the Earned Income Tax Credit and its role in supporting families, helping them make ends meet, and sort of building family economic success. So I'm going to touch on, where states are at right now in the aftermath of the Great Recession. I'm going to talk a little bit about EITC and the role it plays in reducing poverty, and then I'm going to talk about some of the good choices Illinois has made for families and children in this state, despite all the fiscal woes. And I'm talking in the context of all the states, so relative to other states, Illinois has made some positive choices for children and families. So let me just start with where states are at right now. The nation just went through the deepest, longest recession since the Great Depression. That caused an all-out collapse of state revenues. It meant that just as needs were rising dramatically because people were losing their homes and their jobs and income, their savings, state resources available to meet those needs sort of fell through the floor. And as you all know, that meant, unfortunately, that states relied very heavily on deep cuts to critical investments like K-12 education, like childcare, and many, many other services. States have had to close, state lawmakers have had to close in aggregate over $500 billion in budget shortfalls over the past 5 years. So that's meant a lot of cuts. It's meant some revenue raising, but unfortunately more cuts than revenue raising. Today, state finances are improving. Revenues are coming in still about 6% below pre-recession levels, but they are sort of ticking upward. But of course, with that good news comes some new challenges like sequestration, which sort of threatens the states with cuts to federal grants to a lot of programs that we all care about. That means that state lawmakers moving forward are going to have to decide whether or not they're going to find new money to replace those federal dollars that go to things like Head Start, that go to nutrition programs for women and children, and that go to K-12 education and higher education. So, lawmakers choose not to replace those salaries, we're all going to have to deal with the consequences of that. But all of that's just to say that state lawmakers really have faced some very real challenges. I don't think we can deny that. Of course, so have families. Families' challenges have been very real. Unemployment's still high here in Illinois. It's up around 9%. Poverty is at 15%. We've got 22% child poverty, so we're nearing one in 4 kids living below the poverty line in this country. And child poverty is particularly troublesome, not only because of the hardship that those kids have to live through, but also because of the profound effects that poverty can have on children's lives over the long haul. We know that from the research that's out there that even 1 year of living in poverty can have a negative effect on kids' development and ability to learn and achieve in preschool and elementary school. We know that poverty in early childhood can actually impact potential earnings later on in life. And all of this has, I think, a big cost to the economy when you consider loss of potential earnings, when you consider the human capital, I guess, that's foregone, and the cost of dealing with poverty, things like, neighborhoods with high concentrations of violence and crime, bad health outcomes, and even, provision, the need for more public services, public assistance. One study out there puts the cost of child poverty at about $500 billion a year, or about 4% of GDP. So it's no small thing. So we know that family economic well-being has a huge impact on kids, and it has a big impact on all of us. And research, of course, confirms that if you improve family income for low-earning families and kids, it helps kids, and it's also good for all of us. And a number of programs that are out there have been really crucial to helping families sort of, keep their heads afloat, heads above water during the past handful of years as the economy has been so bad. Unemployment insurance benefits have been crucial. Supplemental nutrition assistance program has been crucial, as has the earned income tax credit. Unemployment benefits kept about 2 to 3 million people out of poverty in 2009, 2010, and 2011. We estimate that in 2011, the SNAP program, or food stamps, kept about 4.7 million people out of poverty, 2.1 of them were children. And the federal earned income tax credit, which I'm going to talk about more in depth, is even more successful at reducing poverty. It's in fact the nation's single most effective tool for reducing child poverty. And so I'm going to tell you a little bit about why it's so successful. And this might be, things that you all have read, but I'll just go through it. First of all, it's successful at reducing poverty because it boosts family income. That's pretty simple. Families earning low wages get the boost in income that can help them make ends meet despite low wages, and that can help lift their earnings above the poverty line. The second reason that the EITC is so successful at reducing poverty is that it helps families keep working. It really encourages work. A lot of people over the years have sort of credited welfare reform as the reason for so many poor single moms moving into the workforce in the late 1990s, but we actually know now that the EITC expansion that happened around the same time, or a little bit earlier, had a much larger effect on than the welfare law in producing those employment gains. So that's something to think about, that boost in income that encourages work was more important than changes to the welfare law and moving moms into the workforce. So for families that have very low earnings and are just sort of getting their toe pulled in the labor market, the EITC increases as their earnings rise, and that sort of strengthens the incentive for them to work more hours. That extra time and experience in the workforce can translate into better opportunities and higher pay over time. Ideally, that's what happens. Most EITC recipients, in fact, rely on it for just 1 or 2 years at a time, either until they're able to earn a little bit more or find a better job, or until they're able to get back on their feet again if they experience some temporary their economic situation. So this combination of encouraging work and boosting income is really why the credit is so successful at reducing poverty. And in 2011, the credit lifted over 6 million people out of poverty, and over half of those people were children. But the benefits of the EITC go well beyond its ability to reduce poverty. We know now that the EITC can help improve infant health and birth weight. Expectant mothers who receive the EITC are more likely to receive prenatal care. They're more likely to give birth to healthier infants and to smoke and drink less during pregnancy. We know that it can also improve school performance for children. Low-income children in families that get an additional boost from programs like the EITC or the child tax credit, programs that give people that chunk of cash that lifts their income, do better in school, and they go farther in school. And we know that it can improve children's improve their lot later on in life. Kids in low-income families getting a boost from the EITC are more likely to work more hours as adults and more likely to earn more. So this is good for communities and it's good for the economy because it means more people and families on solid ground and fewer need help over the long haul. And of course, another positive of the EITC is that states can piggyback on all of the positive effects of the credit and leverage the success leverage that success with their own credit. And Illinois, of course, is one of 25 states that does this. The Illinois credit took effect in 2000. You probably know that. It was pretty limited in its reach because it wasn't refundable, which means that if the credit's value went beyond someone's income tax liability, they wouldn't receive the rest in a refund. Later, it was expanded to be refundable for TANF-eligible families, and finally in 2007, it was made refundable to everyone. But still pretty small at 5% of the federal credit. So that brings me to what Illinois is doing right for families and children today, or recently. 2 years ago, you all know that Illinois lawmakers decided to increase income taxes in order to bring in much needed revenue for the state. This was absolutely necessary to help shore up the state's ability to fund critical services, and it was the right thing to do. But it did substantially raise taxes on those at the bottom. And so with, I'm sure, the advocacy of many of you here and your persistence, they last year chose to set in motion an increase to the state's earned income tax credit, doubling its size to 10% of the federal over a period of two years to offset that tax increase on low and moderate income families. This means doubling the help that goes to nearly 1 million families in the state trying to make ends meet on low wages. It's pretty good policy, and it was the right thing to do for Illinois families. But I want to just point out the broader context of what other states are doing, and just emphasize that while this may seem like a small step for the state of Illinois, and there are many other needs that need to be met, this choice to raise revenues and then to improve the tax system for low and moderate income families actually stands in very stark contrast to what we're seeing happening in a lot of other states across the country, including some really close by states. I'll give you an example. I'll pick on Kansas today. In Kansas, over the past couple of years, we've seen lawmakers really take aim at their state earned tax credit at the same time that they've made very deep tax cuts, income tax cuts for the best off Kansans and for profitable corporations. The governor and lawmakers there are looking to eventually eliminate the income tax, and they've not come up with ways to raise revenues to make sure that they can invest in education and higher education and other services over the long haul. So just know that in the scheme of things, as far as the nation goes, Illinois is taking some steps in the right direction. Moving forward, and as revenues improve, state lawmakers in Illinois are going to have a lot more choices that they need to make. And as you all know, the state's families and children are going to be best off if lawmakers target any uptick in revenues towards the investments that matter most, so K through 12 education, pre-K, higher education, childcare, and the other many services that families rely on. And Illinois lawmakers, as I mentioned earlier on in this talk, are going to need to ensure that there's adequate revenue to possibly make up federal cuts to programs that are also really important to children and families in the state. And with your help, hopefully they'll continue to move in the right direction and make the right decisions.
We're going to go a little bit over. If you have to leave, do. But please try to stay.
Good morning, everyone. You can hear me okay, hopefully. I'm thrilled to be here and honored that I had an opportunity to contribute to this year's Kids Count report. Today I'm going to briefly talk to you about the two things that I was asked to talk about, which is Illinois' participation in the Early Intervention Program, that's the Part C of IDEA, and children's health insurance benefits in Illinois, where we've been, where we're going, and what some of the challenges are along the way. The early intervention system in Illinois is one I've been prodding and also promoting for almost 20 years, beginning back in 1996, when I joined the legal team of attorneys who unfortunately had to sue the state of Illinois in regards to their early intervention program because children were languishing on wait lists. As a result of the litigation efforts, the right to early intervention services for all eligible children up until age 3 was established. I believe it's Illinois is the only state that's ever had to be sued on providing early intervention services. Since 1996, we've seen a number of difficult, but many would argue necessary changes to the program. Family fees are collected on a sliding scale basis. We've converted from a grant-based to a fee-based program where both private and public Medicaid is collected. And although there have been threats along the way to the definition of developmental delay, it has remained consistent for many years. Recognizing the benefits of the program, for FY 2014, the governor has raised the allocation to a little over $80 million from what it's been in the past. But unfortunately, that is not enough money to reach and cover all the children who are eligible for this wonderful program. And I mean it. I think that early intervention is really one of the jewels in the crowns of programs that make a fundamental difference in the lives of young children and families. It's a program that not only provides direct services like speech therapy, occupational therapy, service coordination, social work services, and a variety of other benefits. It also works closely with the child's parents and caretakers to support and train them to promote their child's optimal development. Through early intervention, we have the potential to alter the developmental trajectories during the first years of life. But today I'm not going to talk to you about the many list of benefits that are in the report. We all know a lot of them. That's why we do the work we do. What I want to do is challenge us all to think about how we can improve the early intervention system in Illinois. And there are a few particular challenges that I want to highlight. We've all come to recognize the benefit of targeting at-risk children for inclusion in early childhood programs, such as Preschool for All, Enhanced Start. But that true targeting has unfortunately not filtered down to the level of our early intervention program, where it would be equally beneficial. One primary barrier is Illinois' highly restrictive definition of at-risk eligibility, and I'm going to share that definition with you. In order to be found at risk and eligible for EI services under the category of at risk for substantial developmental delay, the child has to have a parent who has been medically diagnosed with a mental impairment, which unfortunately is going to require parents to self-identify, which we know a lot of parents with severe mental impairments are not going to want to do. Or you have to have 3 or more, I repeat, 3 or more of the following risk factors. Current alcohol or substance abuse by the primary caregiver. A primary caregiver who is less than 15 years of age, homelessness, chronic illness of the primary caregiver, alcohol or substance abuse by the mother during pregnancy, a primary caregiver with an education at or below 10th grade, unless the caregiver's age corresponds to their educational level, accordingly, unless the child has been removed from the abuse or neglect circumstances. I think most of us here would readily concur that any one of these risk factors would put a child at risk of developmental delay. Not surprisingly, because of this restricted definition, we serve very few at-risk children in our early intervention program. According to the early intervention data, last year we only served a handful that met this category. Now, we've talked a lot about the fiscal issues facing the state, and I know that serving these children will require enormous and significant state and federal contribution and incredible advocacy efforts from us. But like investments in Head Start and home visiting programs, it is a model that works and is worth the investment. We serve 3.7% of birth to 3-year-olds in Illinois. It's approximately 19,000 children currently in early intervention. If we enhance our efforts, we can certainly serve more. And it's a successful model, and we really need to explore serving more. Where children do receive early intervention services, for many parents, it is a hugely cool awakening to leave the warm cocoon of their early intervention family and enter the school district special education systems, which can feel very much like being set out into the wild to fend for themselves. A particular challenge we see in early intervention is ensuring the smooth transition of children from early intervention to special education services for those who will need them at age 3. There are hundreds of school districts in Illinois and no uniform processes for ensuring smooth transition. So, although some school districts exercise best practice and accept early intervention therapists' reports who've been working on an ongoing basis with these kids, sometimes for 2 or more years, in order to develop those IEPs for eligible children, there are many that do not recognize the values of those reports. And even if they do, there really is no coordinated system to ensure that school districts receive updated reports for early intervention CFCs. This means that in many instances, valuable information that can be shared with school district evaluation teams is either not received or is simply not accepted by the evaluation team. And the child is subjected to unnecessary testing, which costs the district needless dollars and causes families unnecessary stress. All of this is particularly vexing in the city of Chicago, where approximately 200 children are transitioning from Part C to Part B special education services each month. Unfortunately, Chicago's multiple failures to properly transition early intervention children prompted my organization to file a Class State complaint, which we received, and I'm happy to report a favorable decision on this past week. But the issue of effective transition and documentation to support the transition process is one that needs to be addressed collectively by ISB, Department of Human Services, school districts, and the Child and Family Connections Office serving our children. We know that something like a web-enabled password-protected data system where reports can be easily uploaded and accessed by designated school personnel would go a long way to curing this issue. As well, we know a web-based system, which we don't have for early intervention, could, in the front end, improve communication, collaboration, service coordination, and service provision among EI providers, staff, families, and referral sources. So, two challenges. There are many more, but so that we have time for today. On the healthcare. On the healthcare for children front, as we talked about during the report, Illinois is a leader in the nation, compared with only 3.7% of children lacking coverage in 2011. How did we get here? Over many years, it has been a multifaceted advocacy strategy with many partners that involve coalition building, bipartisan advocacy efforts, and, unfortunately, litigation. In addition to the many efforts and accomplishments outlined in the Kids Count report, the Manasofsky class action lawsuit, which some of you may be familiar with, filed in 1992 by Legal Assistance Foundation and later soon by Shriver Center and Health and Disability Advocates, served as a catalyst, enabling Illinois to expand insurance coverage to all uninsured children, regardless of income level, and in particular to non-citizen children. The consent decree also paved the way for Illinois' healthcare expansion efforts. Unfortunately, after many of the great gains that are highlighted in the Kids Count report, the state, due to budget concerns, capped all kids' eligibility at 300% of the poverty level, cutting off close to 4,000 children last year, who may not have access to health insurance again until 2014. This means that many children above 300% of poverty are forsaking necessary preventative care, actually costing the state more money. In addition, no special allowances were made for children like many we serve in our medical legal partnerships who have complex medical needs. Their families must spend down a significant portion of their income in order to receive any medical care. In spite of drastic cuts for the children the past year, we are proud that as a coalition of advocates, we have been able to maintain state-funded all-kid coverage for non-citizen children. But we believe we are the only state in the country doing this. The coverage is vital not only to the care of these children, but also helps contribute to overall child population health through services such as immunizations and flu shots. On the horizon, we're going to continue to work to guarantee that children maintain comprehensive health care coverage as we transition to a system governed by the Affordable Care Act, and work to ensure that coverage provided in the marketplace provides all of the benefits guaranteed currently under Medicaid. Thank you.
All right, I know we're running a little bit late. Thanks for staying. We'll pretend they've saved the best for them. I just want to congratulate you and Voices on the 25th anniversary of a wonderful accomplishment. And then they asked me to talk about child trauma, which has not been around 25 years. It's really 10 to 15 years that it's been sort of formally federally funded as a field. So let me sort of condense it down by giving a hypothetical. I say I've got a kid who's not sitting still, not paying attention, disrespecting adults, running away, getting in fights. You all recognize that sort of kid because he's in every public sector system in Illinois. The traditional way of dealing with a kid like that would say, and I can tell you from being a public defender, this kid is a threat to public safety, and this is where you got to do the punishment correctional model and the zero tolerance, and you see where that theory comes in. We've really got to set those limits, those authoritarian structures in those cases. Very traditional correctional sort of approach. The alternative historically has been more of a mental health approach. You look at, well, he's not sitting still, not paying attention, maybe it's health concern, attention deficit, and we look at things like diagnosing attention deficit disorder and possibly medicating with Ritalin, which has some success with those kids. And that's been the traditional alternative to the authoritarian model, and state law recognizes mental illness as some defenses in those cases. Now what we're trying to do is talk about more of a third model of child trauma, which would say, look at things like the fight or flight behavior. If you know this kid's history, maybe you don't want to go right into punishment. Maybe you don't want to go into diagnosing and medicating. That instead, if you focus on issues of safety, back to Barbara's question about fear, issues of adult support, helping the kid with self-regulation skills and building strength as an alternative, that's a very different model that we believe will have some success with some of the kids that we all struggle to work with, some of the most difficult kids. There's been some progress made in moving this philosophy forward, if you will, and some limitations. The United States Supreme Court recently has outlawed the death penalty for kids, has just struck down last summer mandatory life without parole for kids, even in murder cases. And in those cases, the court didn't address trauma yet, but what they said was you can't do all the sentencing across the board mandatory for kids. You've got to start looking at individual issues about the kids and understanding the individuals in the sentencing. So you can see where it opens the door to start making some of these child trauma and background arguments. The whole diagnostic and statistical manual, rather than diagnosing these kids as bipolar and attention deficit and medicating, some of us have pushed for a new child trauma diagnosis. Right now, the only trauma diagnosis is post-traumatic stress disorder and adult diagnosis. There was a push for developmental trauma disorder, which did not make DSM-5, which is coming out in spring, but they're modifying the PTSD diagnosis for fit down for younger kids. So you can see there's some progress being made. What does that leave you with? As a framework, think of trauma as sort of 3 E's, a series of events, negative events that have to occur, and that can be the violence that Dr. Garbarino talked about, or the abuse and neglect, the read Mark Bergman's article in the kids account. So you have these objective negative events. You have a powerful subjective experience of it, which gets into the overwhelming nature of the chronic abuse, neglect, or the violence, as well as gets into the issue of why not everybody gets traumatized. We do have resilience, we do have protective factors for kids. And even for those who do get traumatized, there can be recovery. So that gets into the whole third E of effects. So we look here, objective event, subjective experience of it, and then long-lasting effects. And the PTSD diagnosis looked at the immediate effects like re-experiencing avoidance hyperarousal. We now know with kids there's much more about. There's all the brain development disruption. There's the ACEs, adverse childhood experiences, and long-term effects. We're now even starting to get some understanding of epigenetics and how at a cellular level stress turns genes on and off, and what that triggers in people moving forward. So, and I won't go into all that today, but you start to see how trauma can be this double-edged sword to argue the background for the kid. You don't want to say everything is trauma. Not all kids are traumatized, just like you don't want to attribute every kid acting out to, oh, well, his brain isn't fully developed. If you make everything brain or trauma, then it becomes meaningless. So it's trying to define this more precisely to fit the kids who need the help. What do you do when you have the kids who need the help? We pretty much push a public health approach, which would include training on understanding these concepts, assessing the kids for it, and using treatment, which would include evidence-based practices such as trauma-focused cognitive behavior therapy. But beyond that, what I wanted to emphasize was what Dr. Griffin started to get over to was it's not enough for clinicians to be doing evidence-based practices. 1 hour a week of therapy isn't going to help a kid who's still living in a violent community and doesn't have a safe place. So what we talk about with trauma is the importance of context, safety, the lack of, is there a safe place for the kid? Is there a supportive adult in their life, which we heard the importance of? When you have that basic safe framework of an adult work, then somebody can work with the kid on self-regulation skills and develop strengths, an alternative to the negative behavior. Let's develop some of the positive stuff. And that, to me, is the importance of the work that Voices and you all are doing, that things like the early interventions, the strengthening families, the home visiting, the after-school programs, those all play essential roles in setting a safe context within which these kids can learn to deal with the negative things that have happened to them. And that's the reason why I hope for these kids. They're young, they're still changing, and because of all of you, I think there's hope that we can improve and help their life. So, thank you.
Any questions? I have to ask one quick one, given the nature of the times. Can you say a few comments about the whole school closing issue?
The school.
You're talking about trust and safety and all that. You have a thought about being done?
Sure.
I'm really surprised about this one.
But no, though, if you listen to the whole WBEZ and Harper and Feinberg, you have 29 kids shot in school that year. That's not normal. And how do you redefine that, be respectful of the culture, to redefine that in a way that they can address those issues and take it on in a way to try and, the WBEZ story was all about trying to have a regular homecoming, trying to have a regular football game. Those are the struggles that those kids face, and it's an intergenerational issue. It's these kids then grow up and have kids that we see them cycle through the courts in the system. It's a real concern, but as much as we can keep safety and family and support in mind, you can help some of these kids will get through it and do well. We just want to get more through it.
Kayla, you want to say something?
I want to start by thanking everyone who is still sitting out there. I know it's been a long morning and we've run over a little bit. We really appreciate your attentiveness and your staying. I want to thank the panel and Linda for all of their comments. Many of the comments they made, I think, did several things. They really sat down along with Dr. Garbarino, and his talk really challenged all of us. We're not only in challenging times, but each of us as an individual is challenged to figure out, given the challenging times, how do I find my pathway to not giving up, not being overwhelmed, not saying we can't do it. It's our job and our mission and our shared passion that leads us to, these are very significant challenges, but we will keep going, we will make progress. I really want to underscore that in the midst of all this, and particularly over these last 3 or 4 years, there have been pockets of progress and things that are real accomplishments that folks in Illinois together have been able to do on behalf of children, and you've heard of some of them referred to today. I want to underscore that choices exist. I think Sylvia really eloquently talked about how difficult and really awful the choices are. And in every other matter and presentation, we think about choices, and we think about the state fiscal crisis, and we hear the General Assembly and others throw their hands up and say, well, we have no choices. We simply have to make these cuts, and that's what we have to do. Budgets are choices. Everything in a budget is a choice point. Collective action is a choice. Sitting down and saying, I can't, is a choice. Standing up and saying, oh, you must, and you will, and here's why, and here's good information to explain why this is so important. Those are all choices. So collectively, I hope we can cheer each other on to say we still have a whole range of choices, and we can hold our elected officials accountable for the choices that they make. Another theme I think we've heard is priorities. When we're in these difficult times, there has to be priorities, and everything can't matter equally. So one of the challenges to the whole early childhood, school-age children and adolescents across all the issue areas is how do we frame that set of critical priority choices in a time when we can't go after everything. Another thing, I think that we who understand child development and the growth of children have the capacity to do, which many others, particularly policymakers, often don't do, which is hold the future in mind. And we think of children from the time they're born until the time they're adults, and what we want for them and what is necessary for them and their families so they grow up and reach their potential, and we hold a vision of that, a shared vision, and we must help others not forget it in the pressure and the environment of crisis, and we have to think of the short run. We're not willing to sacrifice a generation of children while the state gets its fiscal house in order. We can't accept that we have to give up a whole generation, and while the state recovers and gets back on foot. We have to do everything we can to help the state get back on foot, and we have to keep reminding everyone that children are growing up every single day. I know my colleagues get sick of my saying this, but you only get one shot at growing up, and you don't get to do it over. So we have to keep that in front of people all of the time. And I want to also acknowledge what I think was a wonderful balance of we brought you here together under the guise of Kids Count to talk about data and the power of database advocacy and the use of solid information, which we believe is critical, and I think all of you do too. But then we had the juxtaposition of Jim Garbarino's whole talk about the importance of context and the importance of all of the factors that influence people's lives and the conditions and the outcomes of their lives, and how we balance and think about data and aggregate information on one side, and we think about Yolanda and Susan and Carlos on the other side, and hold those in our work is a challenge to all of us, and we all have to be missionaries, if you will, about getting both aspects in front of people. So we don't have much to do, but we do it together. And I want to close by encouraging you to stay connected to Voices. I know there's some new folks in the audience, and we certainly encourage you to join us, and we join you in your efforts. And I also want to say that our Kids Count project goes on throughout the entire year, and once the report is released, and we've done a major media launch, and we've done a Chicago launch, we go out around the state and have community dialogues and more regional or local symposia. And if anybody in the room is interested in collaborating with Voices and having us engage with your more local community, we're more than happy to talk about that and engage with you. Finally, and I'm going to do this, on your table are envelopes. We're going to have another 25 years. We're going to need a lot more resources. So if you're feeling generous or want to take an envelope home and at some point write us a check, we will be grateful, and we will care for the trust that you've put in us by sharing your resources with us. So thank you. Have a great weekend and travel well.